All right, let's now turn to this. Health officials monitoring an outbreak of the Hantavirus with at least 3 deaths reported so far. Now, a cruise ship has been anchored near the coast of West Africa. Now, the very rare virus usually spreads through contact with infected rodent droppings or urine, often in enclosed spaces, but can spread from human to human. And while the overall risk reportedly remains low, officials are working to contain any further exposure. So joining us now for more on all of this, we're going to bring in physician, U.S. Air Force trained flight surgeon, Dr. Zaid Fadul, and surgeon and founder of ProCare Consultants, Dr. Evan Nadler. Gentlemen, I'm really happy to have you both on. This is certainly a story that's been gripping the entire world at this point. You've got the World Health Organization. They had this to say about it, quote, human hantavirus infection is primarily acquired through contact with the urine, feces, or saliva of infected rodents. It is a rare but severe disease that can be deadly. Although uncommon, limited human-to-human transmission has been reported in previous outbreaks of Andes virus, a specific species of the hantavirus. Dr. Fadul, let me start with you here. So this strain of the hantavirus, the Andes virus, is really only found in countries like Chile and Argentina. Well, unfortunately, this cruise ship started in Argentina. Is this where this came from? Again, people entering who were already infected in Argentina, entering this boat. What are you making of the situation so far?
Yeah, thanks for having me. And it's a great question. I mean, they called it the Andes virus because of the Andes mountain range there, and that's the region you're seeing. And for 6 months leading up to this, they've had an outbreak. PAHO is put on notice. I think 20 people died in Argentina in the last 6 months from this strain of the virus.
Oh.
And so those cruise ship passengers had been traveling around Argentina prior to getting on the ship and then potentially exposing everybody else. It's really unfortunate.
And again, I'm looking into this. It says, especially that Andes strain has a 30 to 40, maybe 50% fatality rate. That is absolutely terrifying. I have to ask you now, right now, nearly 150 passengers, I believe about 147, they're not allowed to leave the ship. But I guess the question is, what exactly are the risks to the general public? Again, AP were actually reporting this morning that there was a Swiss passenger who already is off the ship and tested positive. How alert should the general public be at this point, Dr. Nadler?
Yeah, so the Andes virus seems to have about a 1 to 8 week incubation period after an exposure. So the ship left port, I think, April 1st, and we're here a month later, and some might be asking why it's still in quarantine. And that's why. It's because it takes a long time for the virus to go from an exposure to actually producing illness. So the thing that people should remember is that most of the cases of human-to-human transmission are from close contact, like passengers sharing a cabin on a cruise ship. So for folks in their everyday business, it's very unlikely that someone with the hantavirus could pass it on to you in a normal daily interaction.
Okay, well, that's certainly very positive to hear. Dr. Fadul here, I have to ask you, cruises, never taken one, no interest in one. They terrify me. We've seen a lot of norovirus outbreaks. We saw in 2020, of course, there was the COVID quarantine off the coast of Japan on a cruise ship. If you're planning a cruise, should you reconsider? What is your advice to people who have a cruise coming up?
Yeah, I think it's really important to understand what the risks are to wherever you're traveling. I mean, these people were going to the Argentina into that area. And so if they were aware of this and didn't take precautions, that's on them. If you're going on a cruise, I think the key thing is hygiene. Good hand hygiene goes such a long way in preventing any outbreaks. Beyond that, if you're immunocompromised, it may be a good idea when you're in close quarters, like Dr. Nadler was saying, if you're in that really extended period of time, to wear an N95 mask. I mean, typically you get these outbreaks because people are around each other for long periods, breathing the same air when they're not outdoors, and that's the spread. I personally don't think cruises are a high risk. There's always a chance, but they go out of their way to try and keep these ships as hygienic as possible. You just have to do your part as well.
I still have not been convinced. You're still not convincing me to take a cruise. I'm still terrified. Dr. Nadler, Dr. Fadul, really great conversation this morning, gentlemen. Appreciate your insight.
Thanks.
Thanks for having us.